These practices are designed for people following total knee replacement surgery. You will need a chair, the wall, and a solid surface to lie on. If at any point you find that you're having pain or have a hard time breathing deeply and calmly, consider backing away from the exercise and maybe even taking a break at any point throughout the practice. Have a wonderful practice. So in this series, you'll be using the wall and a chair. So have the chair, the back of the chair, be facing the wall and take a wide stance. Yep, so separate your feet. And then you're going to turn your front foot, the foot that's facing the chair, out so that the pinky edge of your foot is parallel with the long edge of your mat. The back foot can come to the wall for stability if you would like. And then your hand can go to the chair for balance. And then start to bend your front knee. Make sure you can still see your big toe. And if you feel okay for balance here, go ahead and lift your front arm up, parallel to the ground. And maybe even press your back hand to the wall, or you can even lift it up towards the ceiling if you want. Great. Breathe. This is a modified version of Warrior 2. Fantastic. You can even gaze for balance over your front middle finger if you'd like. Now go ahead and straighten your leg. And then start to bow forward. Bring your front hand to either the chair, the top of the chair, or the seat. Good. And then your top arm can keep reaching up towards the ceiling. If this is too much on your shoulder, you can always drop your arm down by your side if you need. You're getting stretched definitely in the front of the leg. And then slowly come on out. And bring your feet back together. And then go ahead and turn around. So you're going to take a wide stance again. Bring your back heel to touch the wall. Even turn your foot a little bit away from the wall. And then turn your front foot out so the pinky edge of your foot is parallel with the long edge of the mat, or perpendicular to the wall. And bend your front knee. Make sure you can see your big toe. And use the chair for balance if you need. Back leg is straight and your front knee is bending. So you can move in and out of this position or stay in a bent knee position. If your balance feels okay, you can lift your front arm up parallel to the ground. And you can even reach your back arm straight up to the ceiling. If you want to test your balance a little bit more, you can gaze over your front middle fingers. Your front middle finger. Arm is parallel to the ground, front knee is bent, back leg is straight. And then go ahead and take a hold of the chair for balance. Straighten your right leg or front leg. Keep both legs straight this time. And then start to bring your front hand down to the seat of the chair. Keep your top arm reaching up. Triangle pose. Try to keep your knees straight. And use the chair however you see comfortable. Keep breathing. You can move into and out of the pose with your torso, or even bend and straighten your knee while you're in this pose. And then slowly come on out. So walk your feet so they're closer to each other, and then turn and face the chair. So you're going to hold on to the back of the chair. And have your feet be parallel to each other. And you're going to imagine that you're going to sit your hips back to the wall. So bend your knees and sit your hips back behind you. And you can hold on to the chair for balance. And if this is pretty easy, you can reach one arm up to the ceiling or even one arm parallel to the ground. And then maybe the other arm parallel to the ground or up to the ceiling. You can move in and out of this pose by coming upright, straightening your knees, and then sinking back down. Sit your hips back like you're sitting into a chair. That's why it's called chair pose. And imagine that there's a block between your knees that you're holding onto. And make sure you're breathing. And then slowly come out of the position. And then move the chair a little closer to the wall. You're going to face the wall. Bring your hands to the wall. And then you're going to bring your foot back to the low rung on the chair. And if this feels easy, you can always move the chair further back or bring your foot up to the seat of the chair. We're going for a stretch in the front of the bent knee. You can stay holding onto the wall, or you can reach one arm or both arms away from the wall. Check in with your balance. Use the wall as you need. Keep breathing. Keep your bottom leg, standing leg straight and strong. You can adjust your back foot either further back on the chair to get more of a stretch. And then slowly release. And try it on the other side. So this is a version of baby dancer. So you're going to bring your foot to the chair, either low or high. You may get a cramp on the back of your leg when doing this, so just find a position that is comfortable. Start with your hands on the wall. Keep reaching up to the top of your head. Keep breathing. Stay here or lift one arm or both arms up towards the ceiling. Try to keep your bent knee pointing straight down towards the ground. It will want to drift out to the side. So again, imagine there was a block you were holding between your knees. And breathe. And then slowly bring your hands to the wall. Gently remove your foot from the chair. And just stand for a few breaths here, noticing how your body's feeling. And then make your way to sit on the chair for our final relaxation. Take a seat. Make sure your feet are on the ground comfortably. Your back is supported. Place your hands either palms up or palms down on your thighs. Close your eyes and start to notice your body. While you're in this seated position, we're going to work on a body awareness practice. Close your eyes and feel the bottom of your feet, the back of your thighs, and your back resting against the surfaces that they touch. Start by bringing attention to your right sit bone. Then bring the attention to the back of the right thigh, the back of your right knee, the back of your right lower leg, your right heel, the bottom of your right foot, the top of your right foot, the front of your right ankle, the front of your right lower leg, the front of your knee, the top of your right thigh, the top of your right pelvis. Notice your whole right leg. Now bring the attention to your left sit bone, the back of your left thigh, the back of your left knee, the back of your left lower leg, your left heel, bottom of your left foot, top of your left foot, front of your left ankle, front of your left shin, front of your left knee, top of your left thigh, top of your left pelvis. Notice your whole left leg. Now let's bring the attention to both sides, both sit bones, back of both thighs, behind both knees, back of both lower legs, both heels, bottoms of both feet, tops of both feet, front of both ankles, front of both lower legs, front of both knees, top of both thighs, top of both pelvis. Deepen your breath and notice both of your legs, from your feet to your ankles, to your knees, to your hips, to your pelvis. You're welcome to stay in this relaxed position for as long as it's comfortable for you. Whenever you're ready, you're welcome to move out into this position and move into the rest of your day. Namaste.